All right, we are back on Morning Line. Thanks for joining us on this Wednesday. Nick Barris along with malpractice attorney Clint Kelly. Phone lines open, 737-7587. If you have a question for the big guy about a hospital, a doctor, a case possibly, let's get to the lines. We've got some lines open if you want to jump in, but we'll start off with Beverly. Whoop, I keep going to the wrong side. Beverly, good morning.
Good morning.
Hey, Bev, what can we do for you?
Got a question. My son's girlfriend went to the hospital in June of last year, and she was having severe headaches, and they asked her if she was pregnant. She said probably about 6 weeks. Well, they done her blood pressures, 224 over something, and they left her sitting in the hallway with some urine, and then she passed out in the middle of the hallway, and they was hollering for people. People walked by and said, somebody will be with you in a minute. Well, she was pregnant. She lost the baby. Then we lost her 3 days later.
What? She died? She died 3 days later?
Yes.
Of what?
They said that her blood pressure, she had a stroke.
Oh, no.
Beverly, where did this happen?
Summit Medical Center.
And have anyone at the hospital administration, anyone talked to you about this to give you a reason why this happened?
No, they just said that she blood pressure was so high that she stroked out in the stem cell in the back of her neck or something. But come to find out, she's 7 months pregnant.
How old was she?
Yes.
How old was she, Beverly?
She was 29.
Oh, boy.
Have you hired an attorney or someone hired an attorney for her to take a look at this?
No, we didn't know because my son wasn't married to her, so we didn't know. You know, that's why I'm calling in and to find out if he has any kind of lawsuit or anything to the hospital.
Beverly, can you, or what's his name?
His name is Kendall.
Will you or Kendall call my office sometime right after the show and ask to speak to Pat? And I want you to pass on this information. Now, she's going to have a lot of detailed questions for you that are going to go in depth about what happened, or at least as much as we can find out.
Okay.
But I'd like to take a look at this.
Yeah, that's fine. And if you stick around, we will have the number. And in fact, I'm going to put you on hold right now also, and maybe our producer can get your phone number if he gets a chance. You're on line 1, Beverly, okay? And we'll get the number, and we can pass that on to Clint, okay?
All right, thank you.
Hey,
Thanks,
thank you for your call. On its surface, all right, it sounded to me, and we didn't delve more into it with her, but it sounds like if there's a problem here, it's because she came into emergency with super high blood pressure, pregnant. They didn't address her. Then she passes out. They pick her back up, sit her there, say, we'll get to you. And then, of course, we hear what happens a day or two later.
That is extraordinarily high.
Yeah, what did she say
Systolic pressure, 224. She didn't say what the diastolic pressure was, but 224 is way off the charts red line. And with a headache, I mean, those two things together would suggest to me, I mean, just from looking at it, that she's either having a stroke that's in progress.
Right then, yeah.
Or some type of aneurysm or brain bleed. And so this is something that looks awfully suspicious to me. Now, the question is, was there anything that could have been done at Summit to try to remedy or save her life? But that's something I want to look into.
Okay, and again, this gets to the big picture for viewers that are watching, wondering, okay, do I have something along these lines that I could bring up? You're going to have to show, as you look into this, and we don't know right now, whether or not they did not abide by the standard of care for someone who comes in this kind of condition. Now, emergency rooms, you know, can be kind of crazy, Clint, right? They're in there, there's very busy. They kind of triage. You know, some guy comes in and his arm's cut off, they take him right back. Okay, if someone comes in and has high blood pressure, sitting there, you can't really tell by looking. What is their responsibility?
Well, first of all, remember, I'm going to start with where we began, which what is medical malpractice. This has element number 2, which is a very bad injury. Okay, so the question is, was there a bad mistake that caused this bad injury? And that's what I would be looking at. And getting back to your question about what is the emergency room's responsibility, well, the first thing would be when she comes in, was she triaged properly? Was she at the top of the list or near top of the list? Secondly, was the appropriate examination and testing done in a timely manner? And then third, whatever treatment options that were available, were they actually used on her such that she could improve and survive this, what looks to me to be a stroke? 29 years old, pregnant, dying at Summit Hospital. That is a case you have to look at, because that's devastating.
All right. Well, Beverly, again, we've got her number, I believe, but we'll pass your number on as we always do at the end of the show. Let's go next to Robert. Robert, good morning. Hey, Robert, are you there?
Yes.
Hey, go ahead, sir. What can we do for you?
I'm going to let my wife tell you the circumstances because my mind is not exactly right.
Okay, that's fine.
Good morning.
Good morning.
Morning.
What you got for us?
Well, my husband had arthroscopic knee surgery back in April of last year. 2 weeks after, well, 1 week after the surgery, we went back in to see the doctor, and my husband was infected. He had an infection. The doctor failed to diagnose it, and we cannot get an attorney to take the case. We've tried several times, and he failed to diagnose the situation. And since then, because of that failed diagnosis, my husband has had to have 5 knee surgeries, a total knee replacement, was in the hospital for a long time, and he had some liver damage because of it. I don't know, it's awful. It's very tragic. I don't think he should have to go through it for nothing, and I don't think this doctor should be able to get away with it.
How old is your husband? Oh, I'm sorry, but how old's your husband?
56.
56? Go ahead.
And when did this happen?
April?
It happened, the surgery was on March 26th.
March.
Okay.
The misdiagnosis was on April the 4th. It was a week after surgery. He didn't want to see my husband until 2 weeks after surgery, but I called his office and told them that when they were coming in that he needed to be seen, and so he went in a week after.
What is the reason that these attorneys are giving you for not taking the case?
Well, one of them gave the reason that they couldn't get our records from the doctor. The doctor is very uncooperative, and he wouldn't provide the attorney with the records. He wouldn't provide me with the records that I requested, the full records, and he wouldn't provide the attorney with the full records either.
Is this a staph infection?
It is a staph infection, yes.
All right, and when do you contend that the symptoms of the infection began after the surgery?
Immediately after.
When did they start antibiotic treatment on him to deal with the staph?
2 weeks after surgery. 1 week after we went to the doctor, to the same surgeon. The following week, I took my husband to the ER at the VA Medical Center, and they immediately began antibiotic treatment. Within 24 hours, he was in surgery. He just about died. I mean, the doctor told us nothing. All he did was give my husband another prescription for pain medicine because he told the doctor that the pain medicine wasn't working. And instead of asking why, he just, we've been a year battling this, and it's not over yet. Very unfortunate.
Yeah.
Why don't you call my office and speak to Pat? I think, because I want her to get more information from you. I don't want to take up too much airtime with this, but please do that, and I'll get back to you, or my staff will get back to you and let you know what we think. Very quickly, as a matter of fact, too, because your statute's probably going to run April 4th of this year, so we should be able to get a response to you within a day or two.
Yeah, stay on hold too, and she's on line too, just in case Rick can maybe get her number for you as well. Listen, thank you for calling. Stay right there and give the number to Rick, our producer, and then also we'll have the phone number again for all of our viewers on how to contact Clint at the end of the show, okay?
Thank you.
Hang tight, man. All right, so we've got a couple minutes before we have to take an absolute break here, but all right, so these other attorneys, and who knows, she probably didn't go to a malpractice specialist like yourself. Maybe she did. But just because other attorneys maybe don't take it doesn't mean you're not going to see something here, right? I mean, what does it sound like to you? And now, infections happen in hospitals. You've told me hospitals are the dirtiest place in the planet.
Oh, yeah.
And sometimes surgeries happen, and an infection is going to happen, and it's no one's real fault. So where could you see an issue here?
Well, the thing that catches my eye in this case is the fact that it was misdiagnosed. I mean, remember, we've talked about this so many times before. The fact that he got infected in and of itself is not evidence of negligence. I mean, it happens all the time.
Yes.
Even when the healthcare providers are providing good care. The question is, were there signs and symptoms suggestive of an infection that were ignored by the physician and that could have prevented these additional knee surgeries that he's had to go through? 5 of them is pretty extensive. And, was there some liver damage due to the infection or the treatment of the infection? That's something that I want to take a look at. But I'm glad she called before the statute ran, because you see how close we're
Yeah,
getting to
it's
April.
really close up against it on that. The other thing that gets to me, if she's telling it as it is, I just don't understand. It seems like some of these cases sometimes, if the doctors in the hospitals would be just a little more responsive. Now, I know that's not going to gloss over when something really bad goes wrong, but that this guy is not responding to the calls, not being helpful, not getting the medical records, which I know you can get hold of. I mean, that's aside from being very competent and good at what they do in terms of being able to diagnose me, bedside manner counts a ton for me. I have a great doctor, Dr. Gaston Jr., who's wonderful. He'll talk to me and put up with my crazy questions. and I don't understand these doctors or surgeons. God, no, don't want to see her. No, not calling you back. No, just he's fine. Take a pain pill. What is that?
Studies have shown time and time again that the doctors with good bedside manner, the ones who aren't jerks, are able to avoid lawsuits many more times than the doctors who are jerks and have no bedside manner. And I get really concerned in a situation like this where someone's asking what appears to be very good questions of the doctor and they're being blown off.
Right. And are they entitled to their records?
Absolutely, by law.
Okay. So I don't understand what this lawyer was saying about that.
There's something lame about that. I just can't put my finger on it. But I don't believe a lawyer would I'm not going to take it because I can't get the medical records. There are tools that you can use to get records from a physician.
Again, and we don't know who she talked to, but the bottom line is there are lawyers that have general practice who can handle, and then there are lawyers like you who are specialists in malpractice.
There are very few of us.
Right, very few of you. So it's possible if she didn't go to a specialist and maybe it was something they didn't see that you would. So that's good. We'll get her number and we'll make sure at the end of this program for all of you to put up the number for you to call. If you're on hold, stay there. It's getting busy, Clint.
Yeah, it is.
We'll take a break, and when we come back, more of your phone calls on malpractice right after this. Stay with us.